Should you always orgasm with sex? Well, that is a myth we are going to address in this podcast. So stay tuned and listen in. So this is Dr. Durst with RevMD Podcast, and I have my co-host with me today.
Hey guys, Faraday Golombieski, family nurse practitioner here at RevitalyzeMD, and today we have a very fun podcast.
This one's going to be fun. In fact, we did one take on it already, which was
It failed.
so fun. So fun. It failed because we were laughing so hard.
We think we're awesome.
Yes, we think we're funny. So we saved you that pain. And so we'll just start with the first myth.
Absolutely.
Again, does sex naturally decline with age? As you get older, are you just going to want sex less?
Earlier we said yes, because of hormone decline.
Yeah.
But it is more than just that. So some may have, we talk about it all the time, how men, their desire, their libido is the last to go. We see men with low hormones that still have a sex drive. Mm-hmm. So it doesn't decline for everybody. At some point, eventually, if hormones go to nothing, then it will decline.
Yes. So I would say that this is again, not a myth. It's actually true that it does decline with age, though, right?
Yeah, this is a hard one because technically, right, the right answer is no, it doesn't decline for everybody, but eventually.
Or it doesn't decline naturally, I think is the key.
Yeah.
Does it decline naturally because of age? No, it declines because of hormones.
There we go.
And so what Faraday's saying is maybe not for everyone because sometimes the hormones, it's declined and their sex drive tends to be. So I would just say across the board that this is true
because
that it declines.
Hormones decline.
With age, but it's not natural. It's because of hormone decline. So that's that one. It was a little tough. It wasn't a good starting myth but it can be a myth busted or not busted. In that, we would say naturally, no, it's because of hormones. So that's a myth. But it does all decline with age. And
if you
we see
live
that
long
in practice.
It goes down.
Yeah, we see it all the time with both men and women. So second one, and this is better. So are men always ready for sex?
Right. So that is a stereotype.
It is.
And we see that in clinic, that we kind of peg men as being this hypersexual being that always wants it, is always ready, and always is on point.
Yes.
But that is not the truth of it.
So we have a saying no man left behind. So again, whether women are seeking out, a hormone optimization because they want to feel better, but our women love sex. And so again, sometimes they're coming to us also because their man isn't always ready for sex, or first it's an issue with them, but then all of a sudden it's an issue with the man not being able to keep up with them. So I would say across the board in practice on a daily basis, we have probably at least one or two women that are telling us that their men are not always ready for sex.
And how do we fix them? And then, because typically it's the other way, we hear women coming in saying intimacy is a huge issue within our marriage. My hormones are off. How do I fix this? I want my libido back. And we regulate hormones. And then it's funny how many come back and go, okay, now I'm fixed. Now fix him.
Yes, correct. Or I didn't know I had a problem until you fixed her.
Or that.
Yeah.
Absolutely. So no man left behind.
No man left behind. And so, no, men are not always ready for sex. It is an innately, a thing with men and the sex drive, but across the board, all men, no. And always, no. So that is a myth because we see it in practice every single day. So love to see the feedback on that.
Yeah.
But that is not what we're seeing.
No.
At all. So third one.
Sex should be spontaneous to be good.
So does your woman initiate sex? This is a huge one because I think that a lot of men would love for that to happen. And a lot of women actually feel guilty because they're not initiating, because we, again, hear that all the time as well. So Should it be spontaneous? So if you knew that with women, there's a desire, there's a spontaneous, and there's a responsive.
Mm-hmm.
And actually, responsive is more common. It's about 15% spontaneous for women. And again, I think that all women are different. It depends on that innate drive. It depends on, hormone optimization once it starts to, become a little abnormal for them. But across the board, women are much less spontaneous with their desire than they are responsive. And what does that mean? That means you've got to involve the clit so that
And there's a whole
arouse.
podcast
yeah,
on
that. Yeah,
on that particular segment right there,
correct. You got to
dedicated just to the clit.
The clitoris is strictly a sexual organ and it has 7,000 nerve endings. And so it is the equivalent of the penis in a woman. And so you have got to pay attention to the clitoris. That's arousal. And so as they're aroused, they're getting better blood flow. And then they have arousal desire or responsive desire.
Yep. So does it have to be spontaneous to be good? No.
No, not
That
at all.
That is debunked.
Yes.
That is not true.
Not at all.
That doesn't mean that women and men do not enjoy spontaneous sex. That's not what we're saying. But it doesn't have to be spontaneous to be good.
Correct. All right. And so the fourth one is, again, this is a huge one. We're going to hear lots of different comments on this one is, should you always orgasm with sex? Does it always have to be?
So technically the answer is no.
Politically correct, or the right answer.
The right answer
is no. Of course not. It's all about connection and intimacy and
however,
it's all about pleasure and connection and intimacy and that quality time. But having said that,
in practice,
the focus
is orgasm.
The focus is orgasm.
Men come in and they're very focused about my orgasm isn't strong, or it's not happening, or I can't get there.
I don't have enough ejaculate.
I don't have it. Women come in, it's not as strong. I can't get there. It takes forever. There is a focus around that. And that's kind of where this comes from, right? This myth comes from is that, if we put too much pressure on the orgasm, then we lose that connectivity, that intimacy, that it shouldn't be the prime focus. But what we see and what we hear from patients.
Yeah, and it's distracting from the intimacy and the connection. Yeah. And so the correct answer is no, of course it doesn't have to be, all about the orgasm. But
did you even say that without rolling your eyes?
No, I had to look down. Like it was definitely, it was a passive eye roll.
Okay. Okay.
It was passive. It wasn't a full eye roll, but it is honestly, the focus and in practice, it is all about the orgasm. And honestly, one of the main things is if we're, again, looking at a youthful sex life, so you're young and you're having sex, there are times, again, I think that women are different than men when maybe the orgasm is still an issue for women. And again, 99% of sex is in the head for women. So that plays a big role. But when it comes down to if we want to say it's all about the pleasure because it gets more difficult to have an orgasm as we get older, then that's why we're answering no right here.
Yep.
But we can do things to improve sensitivity and orgasmic strength as we get older. So if it is abnormal for you to not have an orgasm, then I would say that we need to fix it.
We need to look at your hormones.
The focus of orgasm is now a positive experience for you. Is that a good way to say
that's lovely. Should we move on?
It's enchanted. Yeah, it's enchanting. So anyhow.
We'd love to hear your all's opinion.
So, and then basically what is the next one, which is going to be boring after the orgasm one, but again, it's only sex is just about the physical component of it.
Which we know is not true.
That's not true. And that's not just the correct answer. So
That's just
yeah,
the answer.
yeah.
It's not true.
It's not true. So again, there is that connection. There's intimacy. There is, again, the thing that separates a relationship from being a platonic and friend relationship in sex is the connection that you're having, on a physical level,
Emotional,
emotional
physical.
connection and all of that. But you actually have hormones and, neurotransmitters that are released and are signaled with sex that have significant health benefits that decrease cardiovascular risk with
Yep.
orgasmic frequency,
Stress management.
better sleep.
Yep.
It's physical
Enhanced
activity.
immunity.
Yeah.
Relieve stress. Boosts immunity. Boosts moods. I mean, there is a lot that's going on.
Improves sleep.
Yeah, that's huge.
And yeah, so there is a lot of stuff. But again, and if you can decrease a cortisol level with decreasing stress in sex, then you have a lot of positive physiologic benefit there just in that alone.
So, is the physical aspect important? Yes.
Yes,
But is it the only important part of your sexual health? No.
correct. So, So the next one, this one I'm going to let you address. So
Yeah.
that number one, so it isn't, we knew that was a myth about about it just being physical, but what about pelvic floor issues?
Yeah.
Do men
so
actually have pelvic floor issues?
they can. So this is something that's not discussed very often, but recently had a patient that came in and told me that they were going to seeing a physical therapist for a male patient for pelvic floor issues. So the pelvic floor for men, just like with women, men can Kegel. It's a little bit different, a little bit probably harder to figure out those muscles. There's blogs about very detailed on how to figure out how to properly Kegel as a male. So if you're interested, I implore you to look at those. This is not a tutorial YouTube today, but it can help with strengthening the pelvic floor and strengthening those muscles. It can help with improving blood flow. By improving blood flow, we improve erections. We talk about that all the time. So can men have pelvic floor issues? Yes. Can it affect their sexual health? Apparently, yes. Right? We talk to men all the time that it's all about blood flow when we're talking about erectile dysfunction. So if strengthening your pelvic floor can help increase blood flow, then there is a possibility that then can have a positive effect on your sexual health as well, in erections. It also can help with reduction of pain. And then there was some talk even about incontinence, right? So the urinary control or even fecal control.
Yeah.
So if you have difficulty starting urination.
So if we were to say, do men don't have pelvic floor issues, it's a myth.
They do. They do.
I do want to look more at studies, and if you guys have any men have had some pelvic floor, rehab, PT, have done treatments, we would love to hear about it because
I was the first patient
studies for that. So, yeah.
I've ever had that's come in and said, I'm doing pelvic floor and it's been amazing for my health, my sexual health all around.
Yeah. So
and I'd never heard that before. And then this came up as a myth and I was like, how about that?
Yeah. Well, and so I think we could go on with lots of myths, but I would like to end with this one, with this video. Is sex over when your male partner ejaculates?
No.
So as if you guys are return listeners, you know that Faraday and I do not always agree on everything. And this may be one of those, because I would say, yes, it's completely over when your male partner ejaculates, because most men are not continuing on. So
it's over because they end.
Yes. So I always have said, a little warped, but I've always said that a woman decides when it starts and a man decides when it ends. Because it's not happening unless the woman wants it. And we know that across the board.
Yeah.
But it also, so we can decide when it starts, but just know that they can decide when it ends too. So I would say yes, but
I'm
if
going
you're
to say no.
Yeah.
That's a very male-centered
correct
view. And
correct. Well, no, I
I realize that they may not be able to continue.
or no, they just need to continue in some way. We
Some
have
way.
other appendages.
Absolutely.
But I would love to hear comments from women on this to say how many times is that the case. So
in reality, does it end sex?
So I would say the bottom line is most of the time, yes.
Yeah. The bottom line, does it end? Yes. But should it?
Yeah.
Does that mean 100% signify the end? The answer is no. It does not.
The question is sex over when your male partner ejaculates? Yes.
Shouldn't be.
Like it is. I mean, again,
Yes,
not if you're a good
shouldn't
lover.
be.
So the bottom line is
Shouldn't be.
I would qualify that with yes and put underneath. It should not be. It should be all about her first so that you don't. That's the big thing, because otherwise, if they ejaculate, most of them can't continue on. Most,
but
but
that
they
doesn't
can
be-
continue on with other things.
I like that little movement.
I
you
know
had
they
in your-
can continue on
Are you
with
hinting?
other. But the issue is this: to be a rock star lover, a man should focus in on the clitoris first and all the arousal, and then take care of the woman first. Or if not, and a woman is having orgasm with penetration, she's so close to orgasm by the time you penetrate, that is an irrelevant topic, right? Because so to be a rock star lover, you need to involve the clit and you need to take care of your lover first before you
I
ejaculate.
agree with all of that.
Because I would say 99.9% of the time that answer is going to be yes from a woman. And if a man is being honest with themselves, it is going to be a yes most of the time for them too.
Then that needs to change.
Yes.
Because no, that should
Be
not
the
be the end. I will be the change, Deb. I will be the change.
Be the change you want to make in the world. Be the change. Yes. Be the change you want to make
I
in
will
the
be the
world.
change.
So for you men out there, be the change you
Be
want
the
to make.
change. Do better.
Yes. So we'll end there. We have more myths that we'll address with another one. But and if you have one that we want to, and I'm sure we will get some comments on that one. But again, I think some good, honest feedback would be helpful too. And
Yes.
so just be honest with us when you're doing, like, again, there's exceptions to everything.
And you all are
but
going to shine in those exceptions. I know
I
it.
love it. Look at the positivity there. So, all right. So let us know your comments. Let us know your experience. And remember, we are willing to obviously deep dive into anything wellness or sexual wellness. Thank
Thank
you.
you.